Okay, so we have made it to our last chapter about diagnoses. Now, we're still going to use them because when we get to our procedure codes, we still have to have a reason that we do a procedure. So, but this is our last chapter as far as diagnoses go. So these are Z codes. So Z codes are used when there is a reason to see the physician for something other than an illness or injury. Okay? You always have to have a reason for an encounter. So we've talked about like well baby checks, a screening. Okay? So there wasn't really a problem, right, to list as the diagnosis. So we have to have a Z code. Okay? Preventative care. If you have a mammogram and it's just a screening mammogram, you still have to have a diagnosis. If you have a vaccination, right? So all that kind of stuff is going to be under Z's. Problem with Z, sometimes it's difficult to figure out what word to use. Okay? So a screening, it might be a screening. Screening would be the word that you might look up. Okay? Exposure or contact with. Okay? One big thing, one word that you need to know when you look at Z codes is look at status. So I want you to turn in your I-10 book to the alphabetical listing and go to where it says status. Okay, so you're going to see status and you're going to see about a page of options. Okay, so if you're having a difficult time finding how to look up the word, look at status, see if that's an option for you. Okay, another important thing in Z codes is history. Okay, this is where your personal history and the family history is going to be, because it's really important to code personal and family history because that could affect the way the physician treats the patient. Okay, so if there's a family history of cancer, the physician may treat the patient more aggressively because they're aware of that family history than they would with someone without that family history. Okay, this is where you're also going to find your resistance to antimicrobial drugs. Okay, one thing that I want you to be aware of, I want you to turn in your guidelines. Mine is on page G32. It's right before the big heading that says Selection of Principal Diagnosis. But the heading just before that, or two before that, it says 16. It says Z codes that may only be principal/first listed diagnosis. So turn there with me. Okay, so look at these kinds of codes. All right, so if you have a Z code that is not one of these in this list, it means there's something else that has to be listed first. Only the ones in this list can be your first listed diagnosis. Okay, so if you look at some of the examples, it's general exam, administrative exam, elective termination of pregnancy, infertility, supervision of a normal pregnancy. If you look at Z51, chemotherapy. Okay, so if it's not in this list, it can't be first. So that's one way to tell if your answer is correct, if you list a Z code first, is just go to that page and make sure that it's on that list. Okay. So here's the examples that I was talking to you about. Donation of an organ. Okay. So that's pretty much it for Z codes. Like I said, I think the trickiest part with Z code is just figuring out which word to look up. Again, use that discussion board, help each other, and because someone may have found it or they may have a suggestion of what key term to use. Okay, so now we're going to move on to CPT. So make sure that you have your CPT book because we will start using it immediately.